Dental implants today have come a long way, and the original implants were made of titanium. The discovery that titanium implants could integrate into somebody's jaw was around the 50s. And since then, they've done very, very well. But what has happened with the success of titanium implants is that there's been more and more manufacturers that have come into play and manufacturing protocols. So what we've found is that the implants now have had different compositions, and there are now more alloys added into the mix and in the fabrication process of these implants. With titanium implants, you have to couple two parts that are sometimes made of different alloys. And when you do that in a wet environment of the mouth, you start to have electrical exchange between the two different metals. And when you have that electrical activity in the mouth, that also leads to corrosion. What happens when the implant corrodes? There's a breakdown. The material breaks down. There's an oxidation process that takes place. And in the process, there's a release of ions. Now, when those ions are released, some patients weather it pretty well. Others start having symptoms like allergies or rashes, and some go into some metal toxicity symptoms where they have vertigo, they feel tired, they can't get out of bed, they're lethargic. Ceramic implants, on the other hand, are very inert. Zirconia, that's what those implants are made of, are very stable materials. I mean, zirconia is used for all kinds of things. It's a material that just doesn't break down in a wet environment of the mouth, doesn't corrode, doesn't conduct electricity, and they don't release any type of material into the patient's body. And it's a very strong material. But they're the most natural tooth replacement that anybody can receive when we look at all the materials that are available for implantation today. Ceramic implants are still very out of the ordinary for the practitioner, especially in the United States. Even in Europe. I lecture in Europe and other places around the world, and it's still not very well known. However, those of us who have been using these implants for the last, in my case, at least the last 6 years, we find that they are as successful and even provide better aesthetics when you place them in the front area than titanium implants.